California regulate the price we pay for health insurance? That's a central question to Prop 45, and although it's on this year's ballot, it is actually a question that stretches back decades. Back in the 1980s, the government required all drivers buy auto insurance. There were no price controls, and rates were going up. So Consumer Watchdog jumped in, put Prop 103 on the ballot, and it passed.
The Wild West is over. The sheriff has come to town, and Prop 103 is the sheriff.
Consumer Federation of America estimates California drivers have saved more than $100 billion because of that vote. Well, it's happened again. The government is telling us we must buy insurance, this time health insurance, but there are no strict price controls. So, again, Consumer Watchdog is jumping into the fray.
We all have to buy health insurance in the state of California. It's the law. But there's no one who says health insurance is unaffordable.
That's Jamie Court. He now heads up Consumer Watchdog, the consumer group that put Prop 45 on the ballot.
So what Prop 45 does is it forces health insurance companies to open their books, be transparent about why they're raising rates. It requires health insurance company CEOs to certify under penalty of perjury why they need a rate hike, and the elected insurance commissioner gets to reject the rate hike if he finds it's not necessary.
Now, there is a major difference between Prop 45 today and Prop 103 back in the day. With auto insurance, consumers were completely on their own. With health insurance, there's a board set up to negotiate rates.
We have to remember that the Affordable Care Act was really health insurance reform.
That's Dr. John Ma, a health care advocate, pictured here meeting with the president just last week. Today, he's speaking for the San Francisco Medical Society.
And the insurance industry actually made a number of concessions. Do you recall the phrases, your children can stay in the parents' plan until the age of 26, no denials for pre-existing conditions, no lifetime caps, the medical loss ratios. And so at this moment in time, the insurance industry should be credited for the number of reforms that they've agreed to, and we need to give that time to succeed.
Remember, too, he says, the Affordable Care Act, as run through Covered California, negotiates with health insurance companies. He says we should give Covered California time to work.
We need to search for what's best. It takes time to reform the health system.
Senators Dianne Feinstein and Barbara Boxer support the proposition while Governor Brown is opposed. Now, tomorrow night, we'll look at Proposition 46. That's the one that raises a cap on malpractice lawsuits and drug tests some doctors. Now, during the anti-Prop 45 ads, they often talk about an independent commission.
Right.
That is the Board of Covered California, and that board remains no matter what happens with Prop 45.
That doesn't change.
It doesn't change. The board stays there.